Frozen shoulder is a condition that affects the shoulder joint, causing stiffness, pain, and difficulty movements. In this video, I'll explain the causes, symptoms, and treatment options for frozen shoulder. I will also provide some tips on how to prevent it from happening in the first place. Hello, I am Dr. Soma Sundar, a spine and orthopedic specialist. So, what is frozen shoulder? A frozen shoulder, also known as adhesive capsulitis, is a condition that affects the shoulder joint. It is characterized by stiffness, pain, and limited range of motion. This condition develops gradually and can last for several months or even years. It is more common in people over the age of 40 and those with certain medical conditions such as diabetes, thyroid disorders, and heart diseases. So, what are the causes of frozen shoulder? Frozen shoulder is caused due to the inflammation and scarring in the shoulder joint capsule. It happens when the joint capsule, which is like a bag that surrounds the shoulder joints, becomes inflamed and stiff. This makes it hard to move your shoulder. This leads to a gradual loss of movement in the shoulder joint, which becomes literally stuck. People with diabetes are more likely to get frozen shoulder. This is because too much sugar in your blood can stick to the tissues in your shoulder joints and makes them stiff and weak. The hallmark signs are severe pain and being unable to move your shoulder either on your own or with the help of someone else. So, who are at risk for frozen shoulder? Frozen shoulder typically occurs in people aged 40 to 60 years old. It is more common in women than in men. People with medical conditions such as diabetes, thyroid disorders, heart diseases, or even stroke are more prone. This inflammation can be caused by injury, surgery, or other medical conditions. Now we move on to the symptoms of frozen shoulder. Frozen shoulder usually develops gradually and can be divided into 3 stages. So the first stage is freezing. In this stage, people will have pain and stiffness in the shoulder. This is the most severe stage. This stage lasts for about 6 months and this pain is usually worst at night and can make it difficult to sleep. The stiffness makes it difficult to even move the shoulder. The second stage is the frozen stage. This stage is characterized by a decrease in pain but an increase in stiffness. The shoulder becomes more difficult to move and the range of motion is limited. The final stage is thawing. There will be a gradual improvement in the shoulder movement and decrease in the stiffness. The pain usually subsides completely during this stage. However, it usually takes about 1.5 years to 2 years for complete recovery without any treatment. So, what are the treatment options for frozen shoulder? The treatment depends on the severity of the condition. We can assess the severity based on the duration of symptoms, the pain severity, and the activities which are affected. The initial physical therapy and stretching exercise can be tried to help improve the range of motion and reduce the pain. Here are 3 simple exercises that you can do at home to prevent and treat the frozen shoulder. Number 1 is pendulum stretches. So stand and lean forward with your unaffected arm resting on the table and let your affected arm hang down and swing gently back and forth and in circles. The second exercise is called towel stretches. Hold a towel behind your back with one hand, that is the unaffected side, and grab the lower end of the towel with the other hand, that is the affected side. Try to pull the towel with your good arm to stretch the affected arm. The third important exercise is finger walk. Face the wall and put your fingers and walk your fingers up the wall as high as you can go without pain. Then walk your fingers back down the wall. Do these exercises continuously and have a good improvement in your shoulder range of motion. For more severe conditions, we can give joint injections. Number 1 is corticosteroid injection, which helps reduce the inflammation and pain in the shoulder joint. Recently, PRP or platelet-rich plasma injections have been used, which give similar results. The manipulation under sedation is the most widely done an effective technique which gives immediate results. Here we sedate the patient in the operating room and manipulate the shoulder without pain. Newer techniques such as hydrodilation are showing good and immediate results these days. Final treatment option is surgery. Surgery is usually advised as a last resort and may be necessary in severe cases of frozen shoulder, which are not cured by previously mentioned methods. The surgery is usually done arthroscopically, or in other words, a keyhole technique. Here, the adhesion in the shoulder joint capsule is released under arthroscopic camera vision. So, can we prevent frozen shoulder? While it may not be possible to prevent frozen shoulder in all cases, there are steps you can take to reduce your risk and promote shoulder joint health. Here are some preventive measures. Number one is maintain your shoulder mobility. Perform regular shoulder exercises to maintain joint flexibility, including both stretching and range of motion exercises in your routine. Now, second is good posture. Maintaining proper posture is essential when sitting or working for an extended period of time. Avoid slouching, as poor posture can contribute to shoulder stiffness. Gradual exercise progression. If you are starting a new exercise regimen or lifting weights, progress gradually to avoid overloading and straining your shoulder joints and muscles. Now, fourth is avoid prolonged immobilization of the shoulder. Avoid keeping your shoulder immobilized for extended periods of time, especially after a surgery or an injury. Follow your healthcare provider's recommendation for rehabilitation exercises. Now, five, and the most important, is diabetic management. If you have diabetes, manage your blood sugar levels carefully. There is a link between diabetes and an increased risk of frozen shoulders. Sixth is healthy lifestyle. Adopt a healthy lifestyle including regular exercises, a balanced diet, and adequate hydration. Maintain an overall health can contribute to joint well-being. The seventh is early treatment of shoulder injuries. Seek prompt medical attention and appropriate treatment for any shoulder injuries you sustain. Addressing injuries early can help prevent complications that might lead to frozen shoulder. And finally, hormonal balance. If you are a post-menopausal woman, pay attention to your hormonal health. Hormonal changes may play a significant role in the development of frozen shoulder. Thank you.